Bollywood, right? But remember, there is no complete cure. It is not a cure. It's only that there is a delay in the development of AIDS. Equivalent to, let us say, there are 40 people, including me, and somebody suddenly say, oh, there is an earthquake, run out. Now, suppose this door is open, suppose there is also a door open. So maybe it will take, say, 4 minutes for all 40 of us to go out. So next time, suppose I close this door, and to this door I put some kind of latch, from where only one person just after squeezing can go out. So next time it will take maybe 15 minutes instead of 2 minutes to go out. Same we did here. We couldn't kill reverse transcriptions. But so we couldn't find complete cure. But this is a disease development. So at a time when the AIDS patients were not able to stay more than 6 months, couple of years. Now, if we do the things right and we are taking medication, we can live for 20, 25, 30 years with AIDS. And with the hope that yes, we can find cure. Although there are some sporadic, I would say, that minor results which have come which are not general. So now, just I'll take 2-3 minutes to convince you, as I said, it is highly, highly difficult. I showed you the data, it is spreading like wildfire. But it's highly, highly difficult disease. How to convince you that? Scientifically, for anything to happen, we have to look at what are the requirements for HIV vaccination. First is HIV must be present. There is no behavior in this world where HIV can be created. Let us say there are two healthy human beings who doesn't have HIV. No matter what they indulge in, whatever they do, they can have anything, but they cannot have HIV because none of them is having HIV. First condition, HIV must be present. Right? Second, it must get into your bloodstream. Suppose I have a jug filled with HIV infected blood here, and I don't have a wound on my hand. I can keep my hand dipped in it for 24 hours. I cannot catch HIV because healthy unbroken skin is a perfect barrier. So not only HIV must be present in that activity, it must get in my bloodstream. Now, how many situations you think where something can get inside your bloodstream without your explicit knowledge? To my mind, there are only two situations. One is, I'm going on a highway, I met with a patient. I'm in a remote village, in Mora or somewhere where there is no, up to 4 hours, there is no major blood bank. So the doctor's job is to save me. There is a blood loss. So what did you do? Immediately test what's my O positive. So try to catch hold of someone who's O positive and give that blood to me. Now I am unconscious. Something is entering my bloodstream. I cannot make my own decision. Doctor knows that there can be something wrong, but right now the job is to save me. He doesn't have the time. Knows that there can be HIV in the blood of the person from whom we are taking. But right now the job is that I should be saved. So doctor is helpless. I'm helpless. Something is entering my bloodstream without my explicit knowledge. Second is from mother to baby. If the mother is HIV positive, baby cannot control it. It's not in the hands of baby. Although all babies won't get, I'll present some very interesting information which you can take along with you. So it is equivalent to, let us say that we are discussing what are the requirements, just a parallel study. What are the requirements that the two cars on a road will meet with an accident with each other? There are only two cars. We are trying to see what are the requirements for these two cars to meet with an accident with each other. Number one, we need two cars. So HIV must be. Number two, they must be on the same road. Right? It is not possible you keep one from Nainital to Delhi via Haldwani and the second one you keep from Kaladungi to Delhi. They have to be on the same road. Then they have to be on the same side of the divider. There is a divider, one is going that way, one is going the other. Right? Then most likely on the same side of the divider they also should be facing each other. Of course, there is a possibility that they are going in the same direction. One is at a high speed, one is at low speed. Let us for the moment eliminate it. So they have to be on the same side and they should be going towards each other. At least one of those should be matching. बाकी सारी कंडीशंस ठीक है, सेम साइड ऑफ डिवाइडर भी हैं, सेम रोड पे हैं, दोनों ही दोनों स्टेशनरी हैं, they are not moving, none of them is moving, they can't hit each other. How many conditions are there? You take out any one condition, those two cars cannot collide. How difficult it is to get something in my bloodstream without my experience. Now, many times the question is asked that how long HIV can survive outside body. Well, how long it can survive, it depends on many things like the amount of HIV present in bodily fluids. All bodily fluids do not have the same amount of HIV. Blood has the highest. Then second is what conditions the fluid is subject to. So in the lab, we can keep the HIV alive for 2 to 3 weeks, but under controlled temperature, controlled humidity, everything controlled. 15 to 20, 2 to 3 weeks. Exposure to air. Air doesn't kill virus, but virus cannot live in it. But HIV can survive for very many days in needles, injection needles. It can survive for many, many days. Why? Because injecting needles use injection needles, because it is blood and it likes to stay in blood. So it can survive for many days. That is why you see that sometimes nowadays the things are a little better. Otherwise, earlier you see what used to happen, that the recycled, even in RGR hospital, there is one issue that maybe the recycled needles and syringes were being used. I don't know how true it is, but that was a big scam many times in our country. So that is why when I had both my kids, and whenever we went for their immunizations, for those vaccinations, we always would keep a box of syringes and needles at home and we'll take our own. So you can say that can also be recycled, but I can answer you that how, even if they are recycled and they are at my home, they will not infect my baby, right? So they can survive, HIV can survive for a pretty long time in needles. Now, I said I want to talk like doctors, and I want. What are the activities that allow HIV transmission? First, of course, and the foremost is the unprotected sex. But this is one thing about which the doctors and everybody talks quite a lot. To the extent that they are ignoring all other routes of transmission. Of course, this is one major route of transmission. Sexual route is the major route. But there are many others where we can hit right away. The second is direct contact with blood or other bodily fluids. Direct contact. Blood contains the highest concentration. Saliva and tears. There was a huge debate about saliva and tears because I have the original pamphlets from the government of India of around 1990-92 where they used to say, oh, it can transmit by kissing, mouth-to-mouth kiss. Now it is settled beyond doubt that it cannot survive in saliva unless until you have cankers in your mouth and there is so much of the blood oozing out in your mouth. Otherwise, in normal person's saliva, it cannot survive. Right? So direct contact. Third is mother to baby. Mother to baby, it can survive before birth, during birth, or through breast milk. So I would like to concentrate on non-sexual routes of transmission, where we can really play a role. First is sharing injection needles. I just showed you that Punjab is just exploding in the HIV cases. Why? It is non-sexual route because of the drugs. Wherever you see the use of injectable drugs, you will see the level of HIV exposure. Because they use one set of needles and syringes, 50 people taking drugs, same needle would be being used. So if one person in that whole chain is HIV positive, if you go to US and Europe, you would be surprised if you go for the first time. You're going on a highway, suddenly you see there is a small cubicle and there is a very tiny window and there is a bell outside. You ring the bell, window would open, you won't see anyone, but would be waiting for something. Those are clean needle exchange programs. They say, okay, you are a druggie and you don't want to disclose you are a druggist. At least you should not give the infection to someone else. So you take your used set of syringes, so they will be given set of 5 or 6 needles and syringes. So you go to that kiosk, no identity, no one is looking at you. From inside, you give your 5 sets of needles and syringes used, they'll give you 5 cents meal. Window closed, you go, nobody saw you, you didn't enter anything. That is clean needle exchange. Needle sticks. Imagine in India, in a country like India, like AIMS, one nurse may be putting 400 injections a day. When the COVID was there, you see nurses were putting 1,000 injections a day. Now suppose I have HIV and the nurse put injection to me, and before the needle could be destroyed, you see occupational hazard, accidents always happen. Murphy's law, if anything can go wrong, it will go wrong. It's only a matter of time when it will go wrong. You talk to any nurse, it is impossible in her entire life, it is never that needle with which she picked someone else or he picked someone else, that she didn't pick herself or himself. It's an accident, it will definitely happen. So in the advanced countries, this is something very taken very seriously. Wherever the injection is being made, there are those breakers, needle breakers. Immediately, injection, cut, very well. Not like us, because to save money, especially the smaller hospitals or private hospitals, they would just have, okay, you collect it and then go and there destroy. No. Right at the site, so that it should be minimal. We can never eliminate it, but it can be reduced. Blood transfusions. Many times you read 6-year-old baby got HIV. Why? Because baby got transfusion, maybe due to, you see, dialysis or something. So that means if the blood has not been screened, although by law, it is every blood has to be screened against 5 viruses. And many times you see, even I'm sure that some of you would also be for surprise. If someone from your family, they need blood, they are going for any operation. So doctor says, oh, we need B9 negative blood. And you immediately search in your family and then you go there, you give blood. And then whole life you say, oh, I gave that to you. But the blood that you gave, that will never go to your patient. Never. It's only exchanged. B negative will come from the blood bank. And your blood will go to the blood bank, it will be tested, and then it will be stored. Right? So all blood has to be screened with HIV. Hemophilia treatment. Hemophilia is a disease where body's ability to clot blood is gone. So it is because of factor 8. So for all those hemophilics, the factor 8 is taken from the blood of the other people. So suppose that there is a blood taken from 50 people, and one person out of those 50 was HIV infected. So then all of that factor 8 will be. So at one point of time, 90% of hemophilic patients in the US, they were infected with HIV. Their new rate of infection is 0 because now they understand it. So they test all the blood, and then some synthetic products also have emerged. Other blood products, platelets. So if someone has dengue and has to be given platelets, and platelets have been given from me, and if I am HIV positive, so platelets would also have HIV, and the person would have HIV. And there are certain sections where the risk is much higher. Injecting drugs, the risk is 35 times higher as compared to any other sex worker or normal person. Female sex workers, 30 times. Gay men, 28 times. Transgender women, 14 times. These are from United Women's report, not my own data. Finally, mother to child. This is something where I would like each one of you to pay attention. In a country like India, where the maximum amount of money we spend is on babies, but this is something which we can take with us. Now, mother to child. You see, our data says that suppose we identify 100 mothers who are HIV positive. So we have a complete ward, a complete set of 100 mothers who are HIV positive. And we don't do anything, we only identified that these mothers are HIV positive. And all are expecting they are giving babies, and we exclude that there are no triplets or doublets or no twins. So 100 women will give birth to 100 babies. We didn't give anything, do anything, no medication, only identify. So out of those 100 women, only 20